Hi friends, this is Dr. Swapnil here back with a live presentation. How are you all? How was the day? And good evening to all of you all. So today's session is very valuable session. In this session, you'll get a very valuable tips in regards to your hormonal balance. Which are the main hormones which are involved in the menstrual cycles, and how to maintain a normal balance, which are the dietary requirements, and which are the don'ts. A complete package information you will get in this live presentations. So are you ready? So type in the comment box, yes, I'm ready. I want to know your comments that you are ready for this mega session, which is a very valuable session on hormonal balance. And this September month is supposed to be a PCOS friendly month, means a awareness month, where you need to get aware of your situation, aware of your hormonal changes, which will help you in maintaining a proper balance in your life. So let's tune in. Hi Rati, welcome to the session. So let's start with the session. And if you know, the today's session is how to balance your normal hormones. When you say hormones, what do you mean by the hormones? Hormone means how to maintain a normal balance in your life. The hormones are chemical messengers which circulate in different parts of the body. And these messengers tells each and every cells of the body and each and every part of a body that how you should function, what should be the functioning of each and every cell. So whether it's functioning of metabolism, whether it's functioning in regards to reproduction. I'll just give you an example. Just consider that when you prepare any recipe, or consider you're preparing rice. So all of you must be experts in the cooking, okay, right? So now consider, when you consider the quantity, you have to take a certain quantity of rice and certain quantity of water. And now you have to balance each other. Suppose if you take very less quantity of rice and 10 times of water, it will be very soft. The rice will be very soft. Suppose if you take less quantity of water, the rice will be hard. Similarly, when you have hormones are like your ingredients which has to be balanced in your body. If one of the ingredients are up and down, your functioning of your body, functioning of your hormones will be disrupted. So let's tune in which are the main hormones of your in relation to your female organs. Which are the main hormones? The first hormone is estrogen and second hormone is progesterone. Now in the menstrual cycle, if you consider a 28-day cycle, a 14-day is a mid phase where the ovulation occurs. If you take this in this representation, the first phase is called the pre-ovulatory phase. The second phase is called the post-ovulatory phase. So pre-ovulatory phase, it's from 0 to 14 days, and post-ovulatory phase is from 15 to 28 days. So first phase is called the follicular phase, and second phase is called the luteal phase. And in the follicular phase, it is basically under the hormone estrogen, and the luteal phase is under hormone progesterone. So this is the cycle which you have a normal 28-day cycle. A pre-ovulatory phase, 14 days, usually you will have a ovulation, and post-ovulation up to the menstruation will be under the one of the hormones. That is 2 phases of your life's menstrual cycle. Now this is important to now consider. There are 2 hormones, estrogen and progesterone. If this estrogen and progesterone are imbalanced, you will get a lot of symptoms, and the symptoms include there will be estrogen dominance, because if the one of the phase is prolonged, you will have a lot of symptoms because of that hormone. Now what are the symptoms you will have in case of estrogen dominance? Estrogen dominance symptoms you will be have in case of a periods, menstrual irregularity, delayed periods, excessive bleeding. You can also have symptoms in relation to PCOS. Is one of the condition which you have get most of the ladies will be affected in the fertile period. Even young ladies have this polycystic ovarian disease. You can see females having a early menstruation now because of the conditions, because of the faulty diet and lifestyle. Now PCOS is very, very common now. So when you consider the estrogen dominance, what are the symptoms you will have because of this? Menstrual irregularities, and you will have a lot of androgens, that is male hormones in the female. So you will have excessive hair growth over the face, you will have excessive thinning of the hair, there might be loss of hair, you might have breast tenderness, you might have fibrocystic changes in the breast, you will have mood changes, lot of anxiety, lot of conditions will have affected because of this excessive amount of hormones. So just consider these hormones need to be balanced to have a normal balance of our cycles. Okay, have you got till now what I went to 10? There are two hormones. I've told you about the two phases of a menstrual cycle. Let me know in the comment box if you have been with me S till now. Let me know in the comment box S. I want to hear from all of you all. Next, before shifting, I'll tell you how the hormone is balanced, synthesized in the body. That is basically the estrogen hormone, how it is synthesized. The estrogen hormone, it is basically, you should remember the body secretes hormone and we need to excrete the hormone. So the balance between secretory and excretory function should be balanced. When the secretion is more or the excretion is delayed or less excretion, there is imbalance of both these hormones. So basically the hormones will be secreted by the ovaries and it will be eliminated by means of a gut. So what happens is, whenever the hormone estrogen is secreted in the body, the liver, which is the largest detoxifying agent or organ in the body, by means of a bile, it will get deconjugation of the estrogen will occur, and with the bile, this estrogen will be eliminated in the gut. So the hormone will get eliminated in the gut. Some it might be eliminated in the what you call stool, or some may be in the by means of a kidney. So this is how you balance. Now if you consider the reabsorption or excretion, there is faultiness in this, then there is also imbalance of the hormone. So the secretion also should be at the optimal level and the excretion also should be at the optimal level. So what could be the causes? Now, what could be the causes of all these conditions? Most of the times we have seen that females taking birth pills, that is regulative pills, hormone control pills, and they are basically synthetic hormones which disrupt the normal hormones in our body. Once this disruption occurs, these hormones, which are their natural hormones, will be more in circulation in the body. Second cause of this endocrine disruption is because of the cosmetics. A lot of cosmetics contains benzophenones, paraphthalates, and phthalates. These are the cosmetics which contains this harmful components which can cause disruption of the hormones. So hormone disruption can be because of this cosmetic on the daily usage. And the last is, if that could be a gut imbalance. If there is a gut imbalance where there is dysbiosis, where there are excessive amount of bad bacteria in the colon, then the excretion of hormone will not occur in the colon. So because of that, you will also have hormonal disbalance. Second thing is, there could be insulin resistance, because most of the times we have a long faulty diet and lifestyle. So our cells are become resistant to insulin. So as a result, pancreas secrete more of insulin, and to balance this, you need to have an extra amount of insulin. So insulin gets converted into the male hormones and you have disruption of the hormonal balance. So if you see polycystic ovaries, most of the polycystic ovaries occurs because the follicles do not mature. Now what you mean by the follicles are the eggs. In the first half of cycle, where I say follicular phase, the cells do not mature and egg doesn't get released. So egg doesn't get released, you have a estrogen dominance because of this. So because of this, that is called a polycystic ovarian syndrome, where you have a pre-diabetic state, you are associated with a lot of the conditions like your risk for diabetes, your risk for heart disease, your risk for hypertension. A lot of conditions occurs because of this condition. So you should remember that The hormonal balance is because of the lot of conditions which you have, which could be chemical, because of the chemical, whatever your tablets you are intaking, because of your gut, because of your insulin sensitivity, insulin resistance. All this counts in the factors. Now we have seen all of the causes. What are the symptoms you have in this case? Now let's dive in how to balance your hormones. Once your hormones are balanced, means you have a long fertile period. You will have, once the menstruation is balanced, you will know exactly when to take, when is your fertile period. So it helps in conception, everything it helps because in that. And once your hormones are balanced, your all system is in track. So if there is a disruption of the hormones, your system will be out of track. Okay, so let's start with the which are the valuable tips which I want to give you at present. So are you ready for the tips? Type in the comment box yes if you're ready for the valuable tips. What I'm going to tell you now, the valuable tips, how to balance your menstrual cycle naturally. Okay, are you all ready? Can I see the yes from you all? Okay, Mulli, I can see, Mulli Manju, I can see yes. Pralisha has said yes. So let's start with what is the first tip I want to give you, that is called the seed cycling. There is one condition which is been seed cycling, which has been followed by the naturopathic doctors, and that is a lot of, though there may be less of scientific research, but definitely it benefits a lot of women in balancing the hormones and the cycles. So what do you mean by the seed cycling? Seed cycling means you take seeds, particular seeds, and two types of seeds in first phase and two types of seeds in the second phase of the cycle. In the first phase, you take two seeds. Which are the two seeds you will take in each phase? Now, if I tell you in the pictures, diagrammatic representation, I'll tell you later. But you take in the follicular phase two seeds, that is flax seeds and pumpkin seeds. In the luteal phase, that is from the 14 to 28 days, you take sesame seeds and sunflower seeds. Now, this seeds helps in balancing your normal hormones. It boosts your fertility rate, also that decreases the symptoms of menopause. So each phase, that is of 14 days, you take two seeds. So first half you take two seeds, second half you take two seeds. So first half is from 0 to 14 days, and 14 to 28 days you take separate seeds, which I am going to tell. So first half, that is follicular phase, you take pumpkin seeds and you have flax seeds. So this is how we go by the diagrammatic representation. This is a follicular phase. Until the luteal phase, you take 1 or 2 teaspoons of these seeds, which is the pumpkin seeds and flax seeds, and second half you take sesame seeds and sunflower seeds. Now suppose you have irregular cycles, you have absent menses, then what you should do? If you have this condition, then you have to follow the phases of a moon, from new moon to the full moon and full moon to the new moon, because the new moon phases are balancing with the period cycle. So 28 days of a moon phase also it balances with your cycle. So follow the phases of a moon if you have irregular periods of absent periods. So from the new moon, from 0 to 14 days till the new full moon, you take two seeds, and second half you take two seeds. Now during the follicular stage, you take two seeds. Which are the two seeds I've told you is, first is flax seeds and second is your pumpkin seeds. Now what is the ideology in having these seeds? When you take these seeds, the pumpkin seeds and the flax seeds, they are high in their phytoestrogen, so they have in balancing your estrogen levels. Also, pumpkin seeds contain zinc. So what happens is it helps in stimulating stimulating the progesterone, which is helpful in the second phase of the cycle. And also flax seeds contain lignans, means excessive estrogen which is there, it gets excreted by means of a bowel. So this is the ideology in having two seeds in the first half, and second half, when is a luteal phase, that is called 14 to 28 days, you're taking sesame seeds and sunflower seeds. And both these seeds contains vitamin E and selenium. Now, When you say about sesame seeds, it also contains zinc, which helps in boosting your estrogen levels. They also contains omega-3 fatty acid, which is required for building of the hormones. And sunflower seed has basically vitamin E, so which helps in normal functioning of our ovaries and normal boosting of the ovaries and hormones. And it also contains selenium, which helps in detoxifying of excessive estrogen. So have you all, so how we should use, I've already told you. Now how much quantity you should use? You should can use 1 to 2 teaspoon of each seeds. Now what you should do is you should grind these seeds. You cannot have this raw seeds like this, because the effect is very less, absorption is less. Sometimes what happens is these seeds pass away directly, so that may not be proper absorption in that. Okay, so you have to grind these seeds, and you have to take it for 15 days quantity. You need to keep it in a glass jar in the refrigerator, and whenever you want it, you can take it in the morning time, evening time, both. You can, if you want, you can take both the seeds at one time, or you can take one at morning time and one in the evening time. So there are 4 seeds which are involved, which I've told you, very important. First phase is follicular phase. Second phase is luteal phase. I'll just repeat it because you might get confused again. So first phase is a follicular phase, that is 0 to 14 days. You take 2 seeds, flax seeds and pumpkin seeds. Second phase is from the 15 to 28 days, because 14 you consider as a ovulation. 15 to 28 days, you take sesame seeds and sunflower seeds. Now these seeds which are contained, they contain healthy fats, they contain lignans, they contain vitamins, they contain minerals, which are the very important constituents of this female sex hormones. So that's why you have to do this. You can try this seed cycling, which can be beneficial of most of the ladies if they have irregular cycles. If you have PCOS, it can also boost your fertility or level also. So if any woman who wants to conceive can also try this seed cycling, which can be very beneficial. So are you there with me? So till now you're there with me. Just type in the comment box yes. If you have any doubts, let me know in the comment section, so that I can answer your query later on. So whatever queries you have, just type in the comment box, so I can answer your queries later on. Okay, I will make a note of it, whatever queries you have. So this is the unique concept of seed cycling, which can be beneficial. Now you will ask me how long you should do the seed cycling. Seed cycling is been said that it takes either 3 to 6 months to show the effects. So immediately within 1 month you may not see the effects, but definitely down the line you may see the effects of this. So okay, this is one of the valuable tip I've given you. So let's start with the second point, which is called have a lot of fiber in the diet. So what do you mean by the fiber in the diet? So what happens is, I have told you, this estrogen, which hormones, if there is dominance, gets excreted by means of a bowel. So sometimes what happens is there's a lot of reabsorption of this estrogen. So you have to have a lot of fiber. The fiber, what it does is it gets bind to this cholesterol hormone and it gets excreted out. So that way it helps in, very important thing is fiber, in increase your fiber in your diet. So which are the foods which are very rich in fiber? First is whole grains. You can try with the brown rice, you can try with the red rice, quinoa, millets. All this contains whole grains. You can try with also the seeds, which I have told you. These are very healthy seeds. Nuts, you can have walnut, you can have peanuts, you can have almonds. All these nuts contains also healthy fats, which are required for the building up a normal hormones. So then you have a lot of legumes, lentils. Then also you can have a lot of fruits, vegetables like avocados, bananas, apples, mangoes, apricots. There are contains a lot of fibers in that. Even cruciferous vegetables, very good. Cabbage, you have cauliflower, all these radish root vegetables which are there, they contains a lot of fiber in that. So increase your fiber in your diet, so that will help you in balancing your hormones. And the second benefit of having fiber is, you can have, once you have more of fiber, you can have a fullness in your body, so you tend to eat less of calories. So that is also help you in maintaining your weight. So this is the way how you can increase your fiber in the diet. which will help in deconjugations of the estrogen hormones by means of excreting it or by means of a bowel. So this is how you can do increase your fiber, and see that when you have a fiber in your diet, have a lot of water also, because there are chances if you have too much of fiber, you can get have constipation. So try to maintain some water intake also when you have with the fiber. Third valuable tip I want to give you is that is xenoestrogens, which I told you initially. Now, xenoestrogens means what? Xenoestrogen means there are endocrine disruptors. These are the endocrine disruptors which will disrupt the normal functioning of hormones, which is normal hormones which are there. So these are the naturally synthetic hormones which are present in the environment and in the chemicals, which will mimic like a normal hormones, and they will bind to the estrogen receptors whichever in the body. So the normal estrogen cannot bind at the same cells, and it is circulated in the whole body. So these are the xenoestrogens which are there. Now, where you find this xenoestrogen? Most of the plastics which you have a lot of xenoestrogen. So if you're microwaving, you're using, see that you don't microwave your food with my means of a plastic containers. Try to use most of the glass containers or ceramic containers. Don't wrap up more of food with plastics, because they contains bisphenol, and bisphenol, the component, are called hormone disruptors. It can disrupt your functioning of your normal hormone. It can increase your male hormones levels, and also increases the inflammation in the body. So this plastic wrapping should be avoided most of the time. Most of the times you must be seeing we use plastic bottles in the car, and they get heated up in the most of the, if the plastic bottles get heated, I mean, we drink that water. So indirectly you're having the plastics also with that. So these are the things which can cause disruption of the hormones. So these are called the xenoestrogens. And second, also I told you the cosmetics. You have to be careful with the cosmetics which contains benzophenones, phthalates, parabens. These are the three components you should look for in the cosmetics. I will not say to avoid cosmetics completely, because you might say that I have told you to stop all the cosmetics. I will not say that, but see, those are the ladies who use cosmetic on a daily basis. What happens is our liver is one of the big detoxifying agent. So if excess estrogen, if is there, it will excreted by means of a bowel. Now, when you apply cosmetics to your face, it gets directly absorbed into your blood circulation. And it has been said 60% of the components which I've mentioned gets absorbed directly. And if you apply to the face, the absorption rate is 5 or 6 times more compared to the rest of the body. So try to shift. If you have problems with menstrual irregularity or PCOS symptoms, anything, try to see that these cosmetics can have effect on your hormones. Basically benzophenone, parabens, this cosmetics, try to shift to safer cosmetics. Okay, try to avoid these cosmetics and try to use a safer cosmetics, which will be very useful. So these are the xenoestrogens which you have to be careful. Okay, so I have given you 3 valuable tips as of now. Okay, are you with me? Are you understanding what I mean? Are you getting all the points what I am mentioning, which will be very helpful for you all? So if you find this video to be useful, kindly share to your friends so that they can also maintain their hormonal balance properly, because hormones balance is very important, and especially now most of the ladies are having PCOS symptoms. So balancing your hormones is a crucial thing in every aspect of your life now. So if you find this video valuable, just share it with your friends, okay, so that others also may get this valuable information. Okay, then next point I want to highlight is try to have healthy fats. Fats, we say that fats are very bad to your body, but you require fats because this is the cholesterol. These hormones which are there are called the cholesterol hormones. So we require these hormones to be there in our body. So what you should do is you can have healthy fats, like you should use healthy oils. Now, which is the most healthy oil, which is say is a coconut oil you can use. Try to avoid refined oils, because the refined oils can be disruptors of hormones. Ghee is supposed to be the best. So if you can have a lot of this coconut oil, ghee. This is supposed to be the healthy fats. All the other healthy fats you can have fish, omega-3 rich fish like salmons and all, avocados, chia seeds, flax seeds. All these are healthy fats. So you require healthy fats also for maintaining a normal functioning of hormones. So then one more thing is, you in Indian diet we have a lot of spices, we have cinnamon, we have ginger, all this turmeric you use. So try to have this spices on a regular basis. This also helps in maintaining a normal functioning of hormones. So then you should have is what you should avoid. Now we have spoken of a lot of things like what you should have, what you should given your tips. Now what food you should avoid in case of. So all the added sugars which are there should be avoided, because these added sugars, simple sugars, will shoot your blood sugar level to very high levels, and the insulin levels also increases. And as you know, the higher the insulin levels, more the hormone disruption. So one of the cause of insulin resistance is because of this excessive amounts of sugar and insulin resistance. So try to avoid all the added sugars. So added sugar, which is the try to avoid eating most of the time the white rice, white bread, white pasta, all the sugary drinks, sodas, all the sugars. They contain a lot of sugars. Those canned drinks, all this contains lot of sugars in that, and these sugars are called hormone disruptors. The cookies, candies. So if you want to be reducing the sugar levels, you need to tailor. You can have to decrease this sugar contains in this constantly. Also fructose corn syrup and packet food, all this fast foods you should try to avoid, because they contain a lot of salts and a lot of sugars. So they disrupt your normal functioning of hormones. So try avoiding all this extra sugars in your body, because extra sugars will add to your extra fat in the body, and this will disrupt your functioning of a normal body. So now now I've told you few things, but you also need to do some lifestyle changes also in your life to balance your hormones. The first lifestyle change is you need to have a proper exercise. So proper exercise of 30 to 45 minutes on a daily basis is required. You can have 1 or 2 days of relaxation, that is fine, acceptable. So you have to focus on exercises basically in the lower part of the pelvic region. Now the idea of doing exercise is, you can do the best is the yoga exercise. You can try with the Surya Namaskars. You can try with the yoga poses, basically Sarvangasana, Halasana. These are the yoga poses which is specifically helpful for the pelvic region. Now the concept is, if you concept of this is, if you have a normal functioning of the ovary, when you do exercise of the lower part, you tend to get, these ovaries tend to get more circulation, more oxygenation, so more oxygen supplied to the ovary. So as a result, they will have a good functioning of the ovary. So as a result, the hormones will be well balanced. Now you can also try 1 or 2 times going into the gym. You can do hard workout, high intensity workout, basically in the lower pelvic region. That is also acceptable. And if you can't do regular exercise for at least for 7 days, at least minimum 5 days a week, it is what is recommended on a daily basis. So try working out on a regular basis. Even a brisk walking can be also beneficial in the outdoors. Brisk walking can be also good for your lower abdominal structures and organs. So now we have maintained the exercise. One exercise is done. So exercise also help in reducing your weight. So weight reduction is also crucial. If you have proper exercise, the weight reduction will also occur simultaneously, because PCOS and weight gain goes hand in hand. Most of the PCOS ladies hormone disruptors will have a lot of weight gain. So if you can do regular exercise, your weight will also be maintained on an ideal range. So try to have a regular exercise, and also exercise will have a maintain a regular weight. Then you need to have a proper sleep and stress reduction. These are the 2 things I want to say at the last. Sleep is very important, because 7 to 8 hours of sleep is required, because if you don't sleep adequately, you will have disruption of the hormones like ghrelin and leptin, which will have. So most of the disruptors of these hormones, you tend to eat more when you have a disruption of the sleep, and you tend to gain more weight. So try to have a proper sleep, a sound sleep, 7 to 8 hours. Try to reduce your stress, because the stress hormones can have a bad effect on your organs, and it increases the cortisol levels. So as a result, the glucose levels also will be high. So try to maintain your stress level, stress reduction by means of a meditation, by means of a pranayam. This is also crucial. This is also vital for maintaining a lifestyle changes. So having a proper diet, proper lifestyle, and proper tips which I have told you will help you in balancing a normal functioning of the ovary. So this is a valuable tip which I have given you. So which tip which tip you like the most? Let me know in the comment box, and which you'll try to follow on your daily basis. And which is easier to follow also, I want to know. Just type in the comment box which is the tip you want to follow on your regular basis. Okay, let me know in your comment. I'm waiting for your comments. So one of the, can you please guide diet for fibroid? Yeah, this is the same. Fibroid diet, there's nothing different fibroid diet as such. Most of these fibroids which occurs, most of this PCOS which occurs, most of the endometriosis which occurs in our body is because of the estrogen, excess hormone estrogen. Now, whatever tips I've given you just now, we need to follow that only, because the estrogen is one of the hormone which causes this fibroid. So if your hormone estrogen is balanced, you will definitely have in reduction in the size of the, you can have a better control over the symptoms, better control over hormones, because once a hormone's estrogen is more, you will have all these conditions. And endometriosis, it is very painful conditions where there's deposits of endometrial tissues in the pelvic organs, and you have shedding when the menstrual cycles, you have a lot of bleeding during this time. So this is also because of the hormone estrogen.